Good afternoon. Thanks for joining us. It's 2 o'clock and time to begin today's briefing. Our featured speakers today are Milwaukee County Executive David Crowley, Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services, Office of Emergency Management, Darren Roush, Health Officer and Director of the Greenfield Health Department, Jackie Ovey, Public Health Administrator and Health Officer at the South Milwaukee St. Francis Health Department. We'll start today with County Executive Crowley.
Thank you so much, James. Thank you all for being here. I first want to start today by highlighting the recent revisions that we have made to Milwaukee County's face mask policy, which is applicable to our county-owned facilities that are owned and operated by Milwaukee County. We've made these revisions to align.
I'm going to get to ask a question, but let me clean up this.
Terry Sater, I think you're talking and haven't muted yourself. So these revisions that we have made align with the recently updated guidance from the CDC. So specifically, this update further defines which masks are allowed and which are not allowed. And so when we think about face masks, what is allowed now are cloth face masks with 2 or more layers of breathable, washable fabric, disposable face masks such as non-medical grade paper or procedural masks, and FDA-approved face masks for sign language interpreters. What's not allowed are neck scarves and bandanas, neck gaiters or buffs, winter scarves, face shields, masks with that has the valves and vents in them, and the masks with inappropriate images and writing. Before, we did have buffs listed as being allowable in our second version of this order, but they're no longer allowable with this order that we're putting in place right now. And we do have exemptions from wearing a face mask, and those have been updated as well. So in recognition of the potential lethal threat of COVID-19 virus to employees and members of the public, and given the extensive research that shows a universal mask policy is protective of human health during this global pandemic, the religious exemptions from wearing a face mask have been removed. This change aligns with the state of Wisconsin face mask order exemptions. The following exemptions are recognized in the administrative order, which are for children ages 2 and younger, anyone with a disability that makes it difficult to wear a face mask, anyone who primarily relies on lip reading, anyone advised by a medical professional not to wear a face mask due to personal health issues, and anyone who has difficulty breathing or is incapacitated. And as always, I want to thank you all for your flexibility and service during these difficult times. I understand that there's a lot of rules out there. And so I just want to say I appreciate what each and every one of you are doing to keep your colleagues and your community safe. I also wanted to make sure that folks understand that we're going to ensure that all residents have their voice heard in the 2020 election. And so we realize that transportation can be an obstacle to voting. And because of that, we want to remind folks that the Milwaukee County transit system is available to anyone who needs it. So whether you're dropping off an absentee ballot, voting early in person, or heading to the polls on November 3rd, our Milwaukee County transit system can get you there. So I highly encourage you to visit ridemcts.com/vote to find the route that best fits your particular needs. And to make finding your route even easier, the trip planning feature on the Ride MCTS website or the mobile app will allow you to input your starting point and your destination address. And then it will automatically show you the best route to take. There's even a map that shows early voting locations along bus routes. So also to help bring attention to the importance of voting, you may notice that MCTS has a special message on the front of all of our buses. The digital destination screen are all displaying the question, did you vote? Did you vote? And we hope that folks will see this important question and encourage them to make a plan to vote early on election day. So please make sure to let your voice be heard. And lastly, we've seen a rise in opioid use and substance abuse as people cope with feelings of isolation and stress due to the pandemic. Earlier today, the United States Attorney General's Office announced that Milwaukee County, under the U.S. Department of Justice, Office of Justice Programs, Bureau of Justice Assistance, Comprehensive Opioid Stimulus and Substance Abuse Program, say that 3 times fast, was selected for an additional $1.2 million in funding. And with this additional dollars, we'll be able to develop a Milwaukee overdose public health and safety team as another step in addressing the trends of overdoses and other substance abuse misuse issues that we've been seeing trending since the pandemic. And with that said, I'd like to turn it over to Mayor Baird and say thank you for your leadership as well as we continue to navigate these challenging times.
Thank you very much, County Executive Crowley, and I appreciate the teamwork that we've had between the city and the county on a wide range of issues, from homelessness to dealing with testing to making sure that we're trying to do everything we can to get people to the polls. So it truly has been a partnership, and I want you to know I personally appreciate that very much. We're now on our 4th day of our new configuration of testing sites. As we probably all know by now, the sites that were manned by the National Guard at UMOS and at Custer Obama have closed down as of last Saturday. On Monday, the new site, the new community site, opened at Miller Park. We started out there with over probably 86 people, I think is what the number was, primarily National Guard, but picture it as a teeter-totter in your mind, because what will happen now over the next month and a half, the National Guard will continue to train and work with our local employees, and they will wean themselves off of that site over the next month and a half. So by November 25th or near the end of November, that should be pretty much staffed by local people. Again, the city and the county are working together on that. But I've been very, very pleased that the transition seems to be going well. And sometimes I feel like I'm talking about a no-hitter when I say something like that. But we are seeing solid use of Miller Park. We're seeing solid use of the Northwest Health Center and the Southside Health Center. And so, in fact, for yesterday, the numbers were 1,667 at Miller Park, 405 at the Northwest Health Center, and 289 at the Southside Health Center. So for the week, the total is 6,892, close to 2,300 people a day are being tested. That's the good news. The bad news, of course, is that we're seeing an increase in the positivity rate. Unfortunately, right now in the city of Milwaukee, Milwaukee is now reporting a high positivity rate around 11%, which is basically more than twice what we saw approximately a month ago. So the problem is getting more severe here. In fact, earlier this week, the Milwaukee Health Department reported that 2 of the key indicators of COVID-19 cases and testing were now in the red category. So we've spent the last few days reevaluating our order, and we will be announcing a decision on how to move forward in the coming days. And I'll touch a little bit on enforcement at the end of my comments as well, because there's been a change there that I think people should be aware of. I also want to talk about the work that we're doing to help businesses that have been affected economically by the pandemic. As you may know, we've had this Restart program, which is funded with the federal CARES dollars. Earlier this year, we had Restart 1. We now have basically gone full-fledged into Restart 2, and the city's grants to small businesses through the Restart program will soon be in the hands of small businesses all across the city of Milwaukee. In the second round of the grant program, 967 small businesses applied before the application period closed. That's a healthy number of businesses. We're pleased that they're able to make that application. Restart is focused on a sector of our economy that has been hit hard by the COVID-19 crisis, the small business sector, because small businesses with 20 or fewer employees and revenue of less than $2 million per year have been hit especially hard. And these are vital businesses that anchor neighborhoods, provide important services, and create jobs. These are the small businesses that we all claim to love, and this is where we have to show our love if we really are serious about that. The Restart grants provide up to $25,000 for expenses, primarily focused on costs associated with the pandemic. And the owners of the businesses that applied really reflect Milwaukee's diversity. About half are minority owned. Similarly, about half are women owned. And that means that we're reaching every part of the city. And that's something that's very important to me. And I know it's important to members of the Common Council. The applicants include restaurants and cafes, professional services, hair braiding businesses, salons, art galleries and studios, barbershops, a bowling alley, a bookstore, small breweries, childcare facilities, contractors, food trucks, home-based businesses, We've got bakeries. We have a guitar shop, a yoga studio, and a small tortilla manufacturing company, just to give you a glimpse of what the range has been. Fortunately, our team has been really working around the clock on this, and they've approved more than 1/3 of the restart applications. The money will likely go to these businesses starting next week. In all, we could be distributing up to $10 million in money that comes from the Federal CARES Act. So we want people to know that we're appreciative of that. We've also been working closely with the state, and Governor Evers in particular has been very, very accessible and very cooperative in working with us. And last week, he and the Wisconsin Department of Children and Families announced $50 million in funding for an additional round of child care counts payments for early child care and education. We know that this is a huge issue, that we still have to have child care. We still need to have early education, particularly during this pandemic, particularly as families are being disrupted in their normal schedule. The funding ensures families have access to safe, affordable, and high-quality childcare so that parents can remain in the workforce. The program also funds staff recruitment and retention efforts by ensuring fair wages for high-quality childcare workers. I'm pleased to report that Wisconsin has now set aside over $130 million of its CARES Act funding for early child care and education, one of the highest rates of CARES Act dollars invested in early child care and education in the country. So again, thank you, Governor Evers, for that. I also want to make sure our residents are aware that the second round of the state's The Child Care Counts Supplemental Payment Program opens up applications and program eligibility starting Monday, October 26th, online at dcf.wisconsin.gov/COVID-19. So take a look at that website if you're interested in that. There are two offerings that exist under this program. One is focused on providing affordable and high quality child care, and another is focused on costs associated with staff recruitment, which is an issue, staff recruitment and retention at these child care facilities. The deadline for applying for that is November 6th, so I would strongly encourage our residents and local businesses to take advantage of this resource. Before I turn over to Dr. Weston, I just want to touch on the change in protocol that we are having in terms of enforceability of our bars and restaurants. Prior to now, we have been using a very educational-based metric, if you will, to make sure that there's compliance. Now that we're 7 months into this, we think people either are with the program or they're not with the program. And so the education period is essentially over. Under the old protocol, a phone call to notify the operator of the complaint, and then you had an on-site inspection to verify the complaint, and a warning letter. Now, you're not going to get that warning letter. If you are not in compliance, whether it's complaint driven or not, a citation will be issued. Fortunately, we've had many businesses, most of our businesses have been cooperative, but the rare business that flouts the rules previously, unfortunately knew there were little consequences to a complaint because we were so educational in our approach. They'd get a warning, the citation came after a repeat violation. Now, when a complaint comes into the health department, or when they go out on their own and they confirm the violation, a citation will be issued. This is part of what I've been talking about the last couple of weeks, that unfortunately we've seen a number of bars and other establishments that have not been cooperative. So this is the next step. The education period is over. Now you're either complying or you're not complying. With the serious situation we're in, it's appropriate to get more serious about the enforcement, and that's what we're going to do. And I think after listening to Dr. Weston, you'll understand why we're turning it up a notch. And so with that, I'll turn it over to Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, as always, to our numbers. We've had 36,930 confirmed cases of COVID-19 in our community, and 460 individuals who've died. We continue to see poor trends, both in the state as well as locally. We continue to record number of cases, of hospitalizations, and of deaths than we have seen at any other point in the pandemic. Locally in Milwaukee County, we're seeing the same troubling trends. Like the state, we have higher case numbers than ever before. And unfortunately, as of today, we now have more hospitalized COVID-19 patients in the county than at any other point in the pandemic. We have 254 individuals in our hospitals right now in Milwaukee County with COVID. And with each of these trends, whether at the state or the local level, there are no indications of a slowing of this increase. There is no flattening of the curve. As these numbers increase and COVID is tearing through our community, I've continuously heard people say that they wish they would just get COVID and get it over with. I think anyone can understand this mentality. We're all tired of the pandemic. We're tired of hearing about it, tired of arguing about it, tired of not being able to go to restaurants and to gather with family and friends, and tired of being frightened. But there are several reasons why just getting COVID, getting it over with, is so dangerous and frankly a bad idea. So first, yes, if you're young and you're healthy, it's likely that you would not need to be hospitalized and you would not die from COVID. However, we're still learning about the long-term effects of COVID. This includes fatigue, chronic cough, chest pain, headaches, and the loss of taste and smell, among others. It's been found that 1 in 3 people with COVID surveyed at 2 to 3 weeks out from diagnosis still had persistent symptoms. And even among healthy 18 to 34-year-olds, 1 in 5 had persistent symptoms long-term. COVID's still new, and we're still learning a lot about it. And when looking at other widespread coronaviruses from the past, such as SARS, 40% of those with SARS still had chronic fatigue over 3 years after contracting the virus. We just don't know enough at this point about COVID to know the long-term and lingering effects, even among the most healthy among us. Another reason not to just get over with it and get COVID is the pre-symptomatic transmission period. So this is the time when you have the virus and you're contagious, but you don't yet have any symptoms. You don't know you have it. This is the dangerous period when you can spread the disease to everyone around you, your children, your family, your friends, and certainly none of us want to harm those around us and cause them to have the short-term or potentially the long-term health effects of COVID. So all this is to say that despite all of our COVID fatigue, we must remain vigilant. We will get through COVID. We'll get past this time of physical distancing and of mask wearing, but it's going to take time, and most likely it's going to take a vaccine. Until then, stay cautious, wear your mask, watch your distance, consider all the different layers of protection from COVID in each of the activities that you do, and get tested if you have symptoms or close contact with somebody who tests positive. I'm so pleased to have the South Shore testing site opening tomorrow. Jackie Ovey, who you'll hear from shortly, has made a huge lift to get this site stood up, done an outstanding job, and it'll certainly be so valuable to residents in the southern half of our county to more easily seek out testing when needed. Thank you very much. I'll stop there, stay safe, and I'll pass it along to Darren Roush of the Greenfield Health Department.
Thank you very much, Dr. Weston. I'm pleased to join today to talk about the weekly epidemiology data. But before I jump into the data, I just want to start by addressing several overarching issues that you've heard previously on this briefing, but that will certainly be borne out in the data as we walk through it as well. Number one, Milwaukee County is currently in the midst of the third and most significant period of COVID-19 disease over the last 7 months of the pandemic. We know that pandemics occur in waves, and to date, this current third wave has given us the highest 7-day average numbers for both the city of Milwaukee and the suburban communities. Secondly, we know that data for the most recent week demonstrates not only increasing cases in the adult population, but also increasing cases amongst children 18 years of age and under. We know that last week it looked like we had a flattening of cases in children, but this week's data unfortunately shows an increase in data amongst our school children. And third and lastly, we know that the social determinants of health have a significant impact on COVID-19 disease, not only the trends here in Milwaukee County, but in other parts of the state and the country. Yesterday, the Wisconsin Department of Health Services released new data for COVID-19 that split the data out by racial and ethnic groups. And there was a lot of media attention about the significant disparities that were shown. We know in Milwaukee County that we have seen these disparities and more for several months as we've been reporting data to all of you. And we continue to see these data show disparities week after week. We continue to see higher levels of disease amongst those in lower income quartiles. We continue to see higher rates of disease amongst older, more medically fragile individuals. Notably this week, we've seen a sharp increase in hospitalizations amongst those in the 80 years and older age group. And that's something that we want to bear careful attention to. Lastly, when we talk about disparities, we have seen throughout the pandemic high rates of COVID-19 disease in the Hispanic and Latinx populations. The rate in that population is over 2.2 times higher than any other racial and ethnic subgroup. And the next leading subgroups for COVID disease are the African American and Asian populations. Yet, the current case rates are driven largely by large increases in the adult white population. And I'll also note that we did reflect in last week's data, and we continue to reflect it this week as well, that we're seeing increased cases amongst our American Indian and Alaskan Native populations in Milwaukee County as well. So I'll walk through the data real quickly here as well, just to kind of give you a sense of what's happening in the numbers. And we'll start here today talking about the daily number of cases in the whole population. So what I have on the screen for you here today is looking at the whole county population and looking at the trends over time. I note that we're in this third sort of peak, and we see rates in the city of Milwaukee higher than they've ever been, looking at about 275 cases per day on average as we sit here today. And in the suburban communities, that number is about 140 cases a day. So all told, the Milwaukee area is contributing almost 400 cases a day to the numbers that the state is reporting. And the state has reported some very significant numbers of cases over the last few days. Most notably, yesterday was over 4,000. So this is the trend in the entire population, and I wanted to point out that the trend in the kids is increasing as we look at the data over the last few weeks. So what I have on the screen before you here now is the data looking at those with COVID-19 under the age of 18, and we do see increases noted, and we notably see that the numbers are higher than they have been in both the city and in the suburban communities than they've ever been during the course of the pandemic. So while there was a little bit of a flattening seen over the last few weeks, very recently in the last week to week and a half, we've seen additional cases in our school age population. Going back to the full county report, I'll reflect that deaths are still continuing to remain pretty flat, but it's something that we're watching carefully because the statewide numbers yesterday reported an increase of 48 deaths statewide. Deaths are a lagging indicator, so oftentimes that data comes to us a little bit later than information about cases and hospitalizations. We have been tracking the reproductive number, and what we see here is that largely since early September, we've seen that reproductive number, that transmission rate higher than 1, meaning that there's more significant cases coming and more cases coming from each individual laboratory confirmed COVID case. When we break this data down and look at it a little bit differently between the city of Milwaukee on the top of the screen and the suburban communities on the bottom, we see that very recently the trends for transmission rate are higher in the suburban communities than in the city of Milwaukee. And that's a reversal of trends as we've seen over the last few weeks. It simply means we need to push that number down, folks, because the higher the number, the more secondary spread from each laboratory confirmed case we're identifying. Next, I'll walk through some demographic information. As I said, we're seeing most of our cases in the adult population, both of 25 to 39-year-olds, as well as the 40 to 59-year-olds, continue to push our rates up, our disease cases up. Race and ethnicity, the white population has surpassed the Hispanic population several weeks ago in terms of total cases. But again, as I said earlier, the rates in the Hispanic, Latino, Latinx population still remains the highest, followed by the African American and Asian populations. I mentioned earlier hospitalizations are continuing to trend up, and we see that here on this screen. Specifically, hospitalizations continue to increase, but more specifically, when we look at the population rate, so the number of hospitalizations in a particular age group, we see a very sharp spike here in the 80+ population in terms of hospitalizations. And that really bears considerable watching, because we know with COVID-19, the older and more medically fragile a person is, the more likely they are to have a significant complication that requires hospitalization, and oftentimes death in that age group is a result as well of the disease. Talk a little bit about testing next. We continue to reflect that testing is pending in the most recent week, but we've seen now for about 5 consecutive weeks, and I do believe when we get more complete data as the week goes on, we'll see another week of continuing increasing testing completion in our community, and that's a very good thing. There are a lot of testing options in Milwaukee County and in the surrounding areas, and my colleague Jackie Ovey will speak next about a new testing option that'll be opening in the southern suburbs. So testing is available. Please get testing. We're happy to see increasing testing. As it looks here, last week actually looks like it was the highest level of testing that we have seen throughout the pandemic, topping the week of 4th of July, which was our previous high. So it's nice to see that our testing rates are back up, but unfortunately our trends are heading in the wrong direction. We're seeing increasing percent positivity, and we're seeing increasing trending in cases. Lastly, I'll leave you in looking at the maps. This is the spatial map looking at cases of disease throughout the pandemic. When we drill down a little bit more specifically, we see pretty widespread COVID disease throughout the county. Again, on this map, if the red and the orange areas are the highest incidence of new COVID cases, and we note many areas, both suburban and city of Milwaukee, are being hit very hard with COVID this week. And lastly, I'll just show the testing rate for the last week, and we see a story that we haven't seen in recent weeks, a much more widespread distribution of testing completion throughout the county, and that's very important to see. As I said, testing is available, and we want to make sure that people are getting tested when they have symptoms, or even if they're just concerned about having COVID-19. So with that, I just want to continue to urge people to do the things that they need to do to keep themselves safe. We know that COVID-19 continues to surge. We know that cases are up significantly in Milwaukee County over the last week, and we hear that hospitalizations, and the data shows that hospitalizations are trending up. We need to continue to be vigilant, do the things, and make the appropriate decisions to limit our disease transmission by wearing our masks, watching our distance, and washing our hands. I thank you all very much for your time and attention. I'll now turn the briefing over to my colleague Jackie Ovey from the City of South Milwaukee and St. Francis Health Department. Thank you very much.
Thank you, Darren. As Darren said, I'm Jackie Ovey, and I'm the Health Administrator for the cities of South Milwaukee and St. Francis. And it's a pleasure to be here today with you to announce the opening of the South Shore COVID-19 testing site. Throughout the pandemic, there has been limited opportunity for testing within the south side of Milwaukee County. And we have been looking at weekly at data that Dr. Weston has provided us with the SAFER model that he's developed to determine that a testing site was desperately needed in the South Shore. The site has been established through a partnership among the health departments in the South Shore that include Cudahy, Oak Creek, and South Milwaukee St. Francis. In addition to the health departments, we are grateful to have the support for this site from the Wisconsin National Guard, the State Emergency Operations Center, the Milwaukee County Unified Emergency Operations Center, and our municipal governments. I especially would like to thank the Reich brothers, who currently own the property of the testing site location, as this would not exist without their partnership. The site is open to Milwaukee County residents age 5 and older and that are in need of a COVID-19 test. The testing site is a drive-through site. It's located at 1625 10th Avenue. Let me just share my screen here. And it's in the Dragline building on the former Bucyrus campus. It opens tomorrow at 11 a.m. and it will be open Tuesdays, Wednesdays, and Fridays, 11 a.m. to 6 p.m. and Saturdays, 10 a.m. to 2 p.m. We ask that any individuals that are coming to the testing site to pre-register at the Wisconsin COVID Connect. This information is available at many of our local websites, and it's also available at the testupmke.com website. You can also take a questionnaire at that site regarding your signs and symptoms and look for a location that's near you. This is a free testing site, and it's open to anyone in Milwaukee County. Thank you.
Thank you, Jackie. We have a couple of questions. First, from Mary Spicoza for County Executive Crowley. You mentioned that neck gaiters and bandanas will no longer be accepted as masks. Is that specifically at county facilities and/or on buses, or the city and county wide in general?
So as you may be aware of, we don't have a health department, so we cannot put in a guidance for county-wide. So this is for facilities that are owned and operated by Milwaukee County, including our Milwaukee County transit systems.
Excellent, thank you. And from Sharon Bagenda for Darren Roush and Dr. Weston. Yesterday, the state saw the highest single-day deaths reported so far. As far as Milwaukee County goes, what age group has been most affected by the recent COVID-19 related deaths?
Yeah, I can start with that. So certainly we've noticed our higher age groups, as they've been affected with most deaths, are certainly most affected with these more recent deaths as well. If there's interest, we could break down those numbers in more detail in the future.
Excellent, thank you.
Yeah, and I'll just add from the data point of view, when we look at death rates amongst Milwaukee County, we see the most deaths in the age group over the age of 80. So we see a rate of about 3 to 4 times higher in the 80-year-old group than we see in other age groups. So deaths do increase with age, and the rate is the highest amongst those who are 80 plus.
Thank you, Darren. From Sari Lesk, much of the enforcement has focused on businesses, while health officials have identified restaurants and bars, along with private gatherings, as the cause of COVID-19 spreading. What can health officials do to address the issues arising from private events?
Well, one of the best ways that we in public health are really working to get the word out about the risk of COVID-19 is through media briefings like this. And we continue to stress that small gatherings are appropriate, keeping your circle really small, perhaps staying within your family is super important to limit the spread of disease. We know that small gatherings and events have been a major source of COVID-19, as well as some exposure at other events throughout the community. But as we start to enter the holiday season, as we turn the page into November and December, we're certainly very concerned with what may happen around the holidays. And so I think it's important as a public health official to come before you today to urge everyone to start thinking about what those holiday plans look like. For the Roush family, that holiday plan is going to look very much like my immediate family and maybe 1 or 2 other family members that have been in our circle because of recent connections with them. So we urge everyone to start thinking about what that holiday may look like looking forward, but even today, start to really keep your circles small, start to limit contact with each other. Just because they're related to you doesn't mean you can put your guard down. We need to continue to wear masks and watch our distance and all of those important public health prevention measures.
Excellent, thank you.
I would just to add real quick, I think it's a really important point that Darren made, that it's not just the large groups. We all know 200-person weddings indoors is a bad idea, but it can be just as bad an idea to have smaller gatherings. You know, a number of smaller gatherings of 10 people can spread it just as much as a wedding of 200 people. And so being really cautious if we are around. And I also think, to the last question about deaths, Deaths are really important. They're an important number to look at. Hospitalizations are an important number to look at. But there's a lot of harm done from this virus to individuals who aren't hospitalized, to individuals who don't die. The long-term effects, the job-related effects that they have. So there's significant effects to this virus beyond that as well.
Thank you, Dr. Weston. The next two questions are for County Executive Crowley and Mayor Barrett. County Executive, will people be turned away if they have, and I apologize, this is from Mark Stevens. Will people be turned away if they have non-compliant masks? Will they be given a mask?
So we will not be turning folks away. Anytime you walk into a Milwaukee County facility or even on our transit systems, we provide masks for folks. So we want to make sure that folks understand that we will provide masks for individuals who don't have a mask or have a non-compliant mask.
Excellent, thank you. And Mayor Barrett, will there be lower attendance parameters under the new order, and when will a new order be issued?
Well, we are in active conversations right now with the health department and the city attorney's office. But as I've said repeatedly over the last several weeks, we're very, very concerned. We're concerned about what we're seeing in bars right now. We're concerned about the gatherings that Darren and Dr. Weston made reference to. So the health commissioner, who just popped onto the screen literally, she will be making an announcement when we reach a decision. I don't know if there's anything you want to add, Commissioner.
No, I think you covered it, Mayor.
Okay.
Just here for support.
Good to see you.
Okay. Well, it appears we have no additional questions going once or twice. If we have no more, thank you all for joining us. We will see you on Tuesday.
All right. Good debut, James.
Thanks, Mr. Mayor.
Okay. Take care.
Thanks, everyone.
Bye-bye.